Hello everyone, myself Adarsh Khandekar and my topic is anti-anginal drug. So in this topic we are learning about calcium channel blockers and its pharmacological action and side effects, dihydropins and drug combination in angina. So let's begin this amazing session. In the in the first in the first slide we are going to learn about normal physiology of the heart. Heart is mainly supplied by the two arteries, left coronary arteries and the right coronary artery. Left coronary artery supply mainly part of the heart. Most of the part is supplied by left artery, and the small artery, right coronary artery supply the small part. Here we see that the heart blood from heart goes to the artery and from the veins comes in the heart. So as you know, the arteries created the afterload on the heart, and the veins created the preload on the heart. Now let's see about the mechanism of action of calcium channel blockers. Calcium channel blockers mainly blocks the L type of calcium channel blockers. L type of calcium channel blockers means long acting calcium channel blockers. So the calcium channel blocks this, and by this due to the blockage of the calcium channels, there is a decrease the contraction of the heart and decreases the load on the heart. So the mechanism of action we can see in this diagrammatic form. It can be easily understandable. Here we see the action, how the muscle contracts. Okay, here all the there are many mechanism of action of other drugs in we mainly seeing on the calcium channel blockers. Here the calcium channel through which entry of calcium entry of the calcium through calcium channel occurs. After the entry of the calcium channel, there is a actin and myosin combination. By combination of actin and myosin, the contraction of the heart muscle is occurs. Okay, when the calcium channel blockages this calcium channel, then the entry of the calcium is not occur inside the cell due to the inhibition of entry of the cell of the calcium in the cell. There is no contraction of the muscles. Moving further, next slide. In this slide we are going to see about uses and the adverse effect of the calcium channel blockers. Adverse effects, the calcium channel blockers causes the constipation, pretibial edema, nausea, flushing and dizziness. These are the side effects. Flushing is side effect due to the calcium channel blockers causes the vasodilation. Due to vasodilation there is a flushing of the skin occurs. Flushing means there is a redness on the skin. Okay, the more serious adverse effect include heart failure, AV node blockage and sinus node depression. These are the most common with vermapil than the least common and the least common with the dihydropin. That's why we prefer dihydropins over the vermapil. Now the uses, the vermapil and diltiazem is used to treat the AV nodal arrhythmia. And the calcium channel blocker are also used in the prophylactic therapy in the both effort and vasospastic angina. Okay, and next is the nifedipine. Nifedipine is given in the acute anginal attacks, and in severe atherosclerotic angina, we use particularly nitrates. Okay, and nitrates combined with the calcium channel blockers. In addition to this, well-established uses in the angina, hypertension, supraventricular tachycardia, and some other diseases. Here the diagrammatic representation of the drug used in the disease. Here we in the angina. Okay, in the chronic angina, the aspirin is used. Aspirin is in the low dose causes the anticoagulative effect. That's why the blood get thinner and flow is continue as if lumen is small, the blood can easily flow. That's why use aspirin. And all the other drugs are beta blockers, nitrates, calcium channel blockers, ACE inhibitors, and and in the acute coronary syndrome we give aspirin, beta agonist and nitrates. Okay, further here is give the other depend upon the ECG and most of the other factors. Okay, moving further slide. In this slide we see the drug combination is angina. Here the drug combination is angina is a very important topic, because in the patient of the angina we not given the single drug. Single drug is only given in the initial case. When the disease move further, there gives the combination of the anginal drugs. Now see, there are three types of drug used in the angina, that are the beta blockers, nitrates, and calcium channel blockers. Of the and the at the onset, matlab, as early we use one of the drug, that depends upon the disease condition of the patient and the adverse effect of the drugs. But in later condition we use the combination. The combination such as beta blockers plus long acting nitrate combined is rational in classical angina, because the tachycardia is due to nitrates is blocked by the beta blocker. That means the side effect of the nitrates is the tachycardia is blocked by beta blocker, and while the tendency of the beta blocker to cause ventricular dilatation is counteracted by the nitrates. The nitrates also counteract the side effects of the beta blockers. Okay, the tendency of the beta blocker to reduce total coronary flow is opposed by nitrates. Moving further, here the above advantages may also be obtained by the combining slow acting DSP with the beta blockers. When we combine slow acting DSP and beta blockers, they also give these benefits. Okay, nitrates primarily decrease preload on, and while the calcium channel gives have greater effect on the afterloads on coronary flow. As you know, the nitrates mainly acts on the vein. They dilates the vein, so that the preload on the heart is decreases, and the calcium channel blockers are decreases the afterload of heart by doing the arterial dilation. Okay, so both afterload and preload on the heart is decreases. That's why the heart has minimum to work, and no pain is occur. Now see some of the MCQs upon the wheel learning topic. Okay, a 45-year-old male patient present to emergency with clutching his chest with the complaint of extreme pain that he developed following his regular morning workout, along with the excessive sweating and palpitation. Okay, here we underline some of the important part. Here they says the clutching his chest with the complaint of the extreme pain. When occurs the pain? After the regular morning workout, along with excessive sweating and palpitation. That's mean it's the exertional angina or the stable angina. Okay, now what they ask, which of the following is the first drug that is need to be given to this patient? The option is sublingual tablet of isosorbide dinitrate, transdermal patch of nitroglycerin, sublingual tablet of nitroglycerin, or sublingual spray of the isosorbide nitrate. Here we can see this is the emergency condition, and sublingual through the sublingual rules, absorption faster and directly act on the heart muscle. So we can't give the transdermal patch. Okay, this option is eliminated. Now we can't also give the spray, because the sublingual tablet has more absorption, and between isosorbide dinitrate and nitroglycerin have greater bioavailability. That's why, and less side effect. That's why we give the nitroglycerin sublingually. Okay, moving further question. The next question is that which of the following is the correct primary mechanism of action of nitroglycerin in the patient of having acute attack of the stable angina? They primarily ask what is the mechanism action of the nitroglycerin. As you know, the nitroglycerin causes the vasodilation, and the veins are causes the preload on the heart. That's why the correct answer is D, decrease the preload on the heart. Okay, moving further question. Next question, this is our last question. All of the following is the indication of using nitrates except as you know, the nitrates can't give the symptomatic relief in the renal colic. So renal colic is the answer. Thank you so much everyone.